My name is Emily Ingram,
And I'm Rebecca Scott.
and we're going to be doing a presentation on burns for you today. So just to get us started, we have some burn facts. So burns and their treatments have been documented as far back as 3,500 years ago in cave paintings. Also a little fact for you, in 1500 BC Egypt, burns were commonly treated with a regime of cattle dung, beeswax, ram horn, and barley porridge. So we've come a long way on burn care. Burns and fire are the fourth leading cause of accidental death for adults and children. 75% of all burns in children are preventable. 80 to 90% of burn cases occur in the home, and scald burns are the most common type of burn in children.
So there are different types of burns. Your superficial burn is your first degree. I think sunburn, it's going to be red, it's going to be painful. It only takes a couple days for it to heal though and go away. And then you have superficial partial to deep partial, which is your second degree burn. It is also red, but you get blistering with this one, and it's extremely painful. And full thickness burns are your third degree burns, and it's that bottom picture of that hand. They're usually white, black, brown, dry and leathery. These are painless. You will get pain around that third degree burn area, but yes, it's painless. And so this slide just shows you the degrees of burns and how far they penetrate the skin. Your first degree has that first epidermis layer. Second degree goes a little farther. The third degree, you get down to that subcutaneous tissue. Your sources of burns, as you can see, there are a couple different ones. You have chemical burns that can be due to acidic chemicals or basic chemicals. The picture that is in the shape of a paw is in relation to a henna tattoo. And then you have thermal, which is your fire burns, friction burns, if you're riding a motorcycle and get road rash, contact burns, touching a hot stove or some hot metal, radiation burns, sunburn, scalding burns are from water or grease, usually children get them. You have electrical burns, and this gentleman in the top right corner got hit with a bolt of lightning in inhalation.
So your assessment is going to be kind of similar for assessment of other patients, especially in an emergency situation. You're going to do the A, B, C, D, E. So first you want to start with their airway patency. So burns can cause a lot of airway swelling, so you're going to make sure that they're able to move air. Also looking for inhalation injuries, such as like you'll look for soot in the nose or the mouth. You're going to want to look at breathing, their work of breathing. You're going to want to listen to lung sounds. Just make sure that they're moving air and getting good oxygenation. You're going to want to check their peripheral circulation, so they're losing a lot of fluids and probably becoming hypovolemic and third spacing, so you want to keep an eye on that. Cardiovascular status, you're going to want to look at their heart, especially if it's an electrical burn, since the heart runs on electricity. They're going to have some electrolyte imbalances, which can also affect the heart. Carbon monoxide poisoning and hypoxia can cause neurological changes, so you want to keep assessing their neurological status. You're going to want to look at disability and deformity with their injuries, and you're going to want to expose the patient. So you're going to want to get all clothes off, any jewelry that can constrict when edema forms, and just make sure you get a really good look at their body and make sure you're not missing any injuries. This is just an example of the soot in the nose, so this could be a possible inhalation injury. If you see something like this in your patient, you're going to want to have some emergency airway equipment at the bedside. The rule of nines is a way to assess total body surface area that has been burned. You can use this with any of the types of burns that we've discussed. This exact one right here is used for ages 14 and up. They have one for smaller children as well. It is used to determine the amount of fluid used for a fluid resuscitation, so it's pretty simple. You can just go by the chart and use the numbers to figure out. It is limited, however, by human error, and if a person is, relatively larger than the standard body or relatively smaller, calculations may be off a little bit. Some common complications, one of the biggest things we're going to look for in these patients is infection, possibly leading to sepsis. Also hypovolemia, they're losing a lot of fluid, especially into the third space. They could possibly have respiratory collapse from an inhalation injury. Compartment syndrome is a big one, especially with circumferential burns. This patient right here had an escharotomy due to compartment syndrome on the chest and abdomen. Hypothermia, so they're losing a lot of body heat through these burns, so we're going to want to keep a warm room. scarring and contractures from the injuries, and you are going to want to monitor their mental health and look for PTSD and depression.
So there are probably a lot of diagnoses out there for burns. These are just the ones that we thought were most important and the ones to hit on. You will obviously have impaired skin integrity, your fluid volume deficit, you have an increase in capillary permeability and evaporation, impaired circulation, impaired physical mobility, infection, as you mentioned with sepsis, is a big deal. Patients will have altered body image, hopelessness that'll relate to their mental health status. They're going to have pain due to the tissue and nerves that are injured. They'll have imbalanced nutrition, and they have a risk for an ineffective airway clearance just due to smoke inhalation and possible edema with the burns.
So these aren't all the nursing interventions. There's plenty that you can do related to those diagnoses. These are just some of the big ones. You're going to want to use a pain scale and treat their pain accordingly. Remember that pain is the 5th vital sign, and it's very crucial to treat these patients' pain. You're going to want to maintain a warm environment. They're at risk for hypothermia, so keeping them covered with blankets, sterile sheets, keeping the room warm, possibly warm fluids. You're going to want to perform those range of motion exercises to prevent any contractures from the skin healing. You're going to want to encourage a high-calorie, high-protein meal. They may need upwards to 5,000 or more calories a day to help heal these burns. You're going to want to look at their coping mechanisms and provide emotional support. It's a really tough thing to go through a burn, so you're going to want to evaluate these in your patient. Monitor the wounds for any signs of infection. Ensure that you're doing clean, sterile dressing changes to prevent infection. Monitor their vitals, their fluid status, cardiac status. Just keep a really good eye on these patients as they can quickly deteriorate. And you're going to want to keep a strict intake and output. So the treatment, like we've talked about a few times in these, fluid resuscitation. So one of the biggest formulas used is the Parkland formula. So this is going to be 3 to 4 mLs times the amount of body area burned, the percentage, times their weight in kilograms. So you're going to divide this in two. The first half is given over the first 8 hours, and the second half is given over the next 16 hours. Most of these patients are going to receive antibiotics as treatment just to kind of help prevent these infections. They may need a fasciotomy or escharotomy like we saw earlier. You're going to want to treat these, as an open wound. That's just another area that can be infected. Hydrotherapy and debridement. This is going to be super painful, so pre-treating them with pain medications. Pain management, if they're in too much pain that they can't eat or move, that can be a really big issue with these patients. And skin grafting to kind of cover the area and help it to heal.
So we found a couple articles for evidence-based practices for burns. One of the big ones is screening for depression and PTSD because the mental health is just as important as their physical health. And so this article focused on screening patients post-hospitalization in an outpatient setting. Like their very first doctor's appointment after they got out of the hospital is when they would screen them. They did surveys, they used screening tools, they created their own algorithmic tool to determine if patients were at risk for PTSD or depression, and then they would make recommendations to go get therapeutic help. And they found that it was more helpful, their screening tools, to be able to discern this risk, and they compared it to the data that they had before because they weren't doing this routinely like they should have been, and they saw a great increase in how many people they recommended for this help. The other two articles I focused on were non-pharmacological therapies for burn patients. The first one was about music therapy, decreasing pain and anxiety related to the rehabilitation of burn patients. And this article used mostly it in a complementary way with pharmacological interventions. So along with pain medication, they would use music therapy prior to dressing changes or any other kind of pain-related anxiety they were having. The guided imagery article was also really good as their focus was on reducing pain and pain-related anxiety during dressing changes specifically, because pain can happen throughout the whole entire process, but the most severe pain occurs during the dressing changes. And pain from anxiety can create gastric ulcers, hypertension, incontinence, other psychological problems, potentially shock. So their focus was to, instead of using benzodiazepines or narcotics, but to use guided imagery as a way to relieve the pain. And the pain-related anxiety is the most common pain that burn patients get. And so they use other therapies like hypnosis and art therapy, play therapy, but guided imagery was the most effective for them. And they did find that it's drastically reduced the pain patients were having during dressing changes, and it helped relax them in a way that sometimes even the pharmacological stuff couldn't do. And so to end, we did just want to leave you with some burn prevention education. It was written by somebody, so it means that it's out there because people did it. So just remember to ensure that your home has working smoke detectors, ensure that you have a fire extinguisher at home as well. Do not smoke in bed or around oxygen. Wear protective clothing and eyewear when working with chemicals. Keep children away from the hot stove, hot appliances, and fires. And if they are around it, turn your pot handles toward the back of the stove so they can't grab onto it and create a scalding burn. Keep electrical appliances away from children, and make sure you have your hot water heater set to 120 degrees Fahrenheit or lower. And if you do end up covered in fire, stop, drop, and roll.
So these are just going over our references, and we just want to thank you for your time today. We hope you've learned a little something about burns, and stay safe.